Well, hi everybody.
Hi everybody,
I am Arkadi Prokopov.
I am Max, I live in Germany and currently we are in Barcelona with Arkadi.
Yes, we're in Barcelona at the end of an international conference. And the reason why we're meeting now, because Max has very good experience with my method for borreliosis treatment. We met about 6 months ago.
Yes, almost seven years.
Yeah, and Max was very interested in my method, very interested. And after learning from me, he told me that he himself has a serious problem, but no real diagnosis. What was the problem?
It was actually that my right leg was hurting so much, doing some exercising or even walking or going steps up and down was quite hard, and it was really huge. I mean, it was full of water, and of course, therefore, the movement was not possible.
Your knee, you mean? Yeah?
My knee, exactly.
Your knee, yeah. Yes, and what kind of therapies did you try?
Well, I did so many therapies. Actually, we did some blood testings with a regular doctor who said, no, the CRP everything is fine. There is no issues on that point. What he actually suggested is to doing some massages over the knees, and I did it maybe for 3 months or something like this without any significant progress in that point.
Yeah. And then I asked you, did you check for borreliosis?
Yes, you asked me this, and I did not check it.
You did not check.
And the very next day, I was back in Germany then. I did the testings.
Yes.
And surprise, or not surprise for you, but surprise for me, it was like this, that borreliosis, the ELISpot test, not the LTT, the ELISpot test was positive in a very high amount. It was above 5, which was 29.
Yeah, we have here all the tests. I will show them in a larger scale so later, but now we just talk. Yeah. So, and then what did you decide? After I told you that I have several cases borreliosis cured with this therapy only, without using any other interventions. What did you do then?
Well, actually, I came back to Arkadi, to Mallorca, and we talked about this again, and he explained it again to me very closely and deeply, and I decided to get one of his machines and to do actually the treatment, the IHHT treatment. And I did it. I did it very sharply, very often, every second day for just about 2 months. And of course, I just wanted to see what happened. I felt it already in my body. I could move my knee much better, and something was different. But I did not have a proof. And I did again the blood testings, and I did again the ELISpot borreliosis test. And well, surprisingly or not surprisingly again, it was negative. So there was no active borreliosis anymore, just with the treatment with that machine.
Yeah, but clinically, how did you feel? What changed with your knee? The edema, inflammation.
The inflammation got back. I mean, all the water which was inside, it got reduced. Of course, I couldn't move any extreme positions, but I could go the stairs up and down. I could sleep better because I had some kind of pillow under my knee so that I could sleep. So I removed the pillow. I didn't use the pillow anymore. So the quality was much better. Yeah. And in that short time of period, I mean, we're talking just about 2 months, but again, breathing every second day. Yeah. And I went step by step. I started with the lowest program. We discussed very closely with Arkadi which kind of progress to make, and I just did it slowly with the lowest step and going much higher to the highest point.
Yes. Also, I think because you have now a machine at your disposal. You can use it every day or anytime. You are now just in the middle of experiment because this clinical healing and also normalization of all analysis, it doesn't mean that all Borrelia are dead, because some of them, definitely the cysts, the smallest inactive inert forms, they are still there. They hide themselves in hypoxic niches, in cartilage, in the tendons, and anywhere in the body. But as long as you continue this treatment, they have no chance to develop.
Yes, I can prove that.
As they develop, for instance, if you don't do this for a couple of months, or if you get traumatized, you get some injury, they can go out. But as soon as you continue this method, they will die off.
Yes.
So several such provocations will clean your body, will clear your body even from cysts. And then you are clinically healthy and biologically cured. Yeah? If you don't do this, what can happen? Borrelia are extremely adjustable, extremely adaptable. They can persist in your body for years and decades, and giving smallest symptoms or even no symptoms. But as you turn really old, for instance, 80, 90, your immunity drops, it's inevitable. And then these Borrelia, which were hiding themselves in the hypoxic niches, they go out and they accelerate your aging process. They can provoke Alzheimer's disease, they can provoke Parkinson's disease, neurodegeneration, and of course systemic inflammation. So they accelerate aging and they reduce drastically healthy lifespan. I firmly believe that this method is a pathogenetic treatment against Borrelia and other neuroinfections.
Well, same on my side. I can tell you also something additionally. I used to go to vacation. I was out for about 2.5 weeks. During that period, I did not have a chance to breathe with that machine. After this time, almost after 2 weeks, I felt something is going back. I mean, the movement, every time I did a movement, it was not hurting, but it's something like the water was coming back from the inside somehow. And I said, oh, well, what's the issue actually? I couldn't understand it. And of course, when I got back home, I started again with my breathing, and just a couple of days, and this feeling got removed. Something was going in background actually. During that time, I didn't breathe. And that's what I can actually 100% prove is I need to continue actually with that machine to reduce it to the maximum.
Absolutely.
I mean, I have, of course, a very good progress during the time I'm using it, but it's not the point just to stop it and to believe, okay, everything is done. This is for sure.
Yes, of course. This is the basis of biological treatment. You need to do it continuously for definitely long time, just to eradicate the cause of disease and at the same time stimulate your immunity. If you don't do this, the balance will be again to the favor of infection. Anyhow, it is one more positive result, one more proof that this method is working, and I do continue this treatment, and you will have more interviews from people, from patients who freed themselves from borreliosis. Thank you very much.
Arkadi, thank you very much for everything.
You're
and
most
for showing this technology to me and
definitely.
understanding it.
Thanks. Okay, bye.
Bye.